In my physical assessment today, I had a 16-year-old female. She was well nourished. She was alert, oriented, respond to verbal commands. Her native language was English. Her composure was erect. Her gait was steady. She needed no assistive devices such as glasses or hearing aids, and her diet was well balanced and nutritional. Her skin was clean. It was in uniform in color, unblemished, and no presence of foul or odor. She had good skin turgor, and her temperature of her skin was warm to touch within the normal limit. Her hair was thick, light yellow, evenly distributed, clean, no signs of any infection. Her nails were light tan, smooth. Her capillary refill was below 3 seconds. Her head was symmetrical, no lesions, bumps, or bruises present. Her face was uniform in color. It appeared smooth and had a consistency of no presence of nodules or masses. Patient's eyebrows were evenly distributed. The client's eyebrows were symmetrically aligned, Her eyebrows were equal to movement, and when asked to raise and lower eyebrows, patient could. The eyelashes appeared to be equally distributed and curled up outward, just so slightly. And then her eyes, pupils are black. They were constricted to light. They were parallel. They were round, equal, reactive to light. The pupils constricted when looking at a near object and dilated at a far object. The auricles of the ears are symmetrical, of the same color with the facial skin. There was no drainage or infection, tenderness or pain noted. When palpating the texture, the auricles are mobile, they're firm and not tender. During the assessment of the hearing test, the client was able to hear me in both ears bilaterally. The nose appears symmetrical, straight, and uniform in color. There was no presence of drainage or discharge present. The mucosa of the nose was pink in color and moist. When lightly palpated, there was no tenderness or lesions, and the patency of each airway was clear. The mouth, the lips of clients are pink, moist. They were symmetric and they have a smooth texture. There's no discoloration of the enamel of the teeth. No retractions of the gum. There was pinkish color of the gum. The mucosa was soft, pink, moist, and the tongue was with elastic tissue. The smooth palates are light pink and smooth, while the hard palate had more irregular texture. The uvula of the client is positioned in the midline of the soft palate. The neck muscles are equal in size. The client showed coordinated, smooth movement with no discomfort. The lymph nodes of the client are not palpable. The trachea is placed in the midline of the neck. The thyroid gland is non-palpable on inspection of the glands. They did ascend during the patient swallowing, but the thyroid was not visible. The lungs and chest, the chest wall was intact. Breath sounds clear, no adventitious sounds heard. There was no tenderness in masses. It was full and symmetric. The client manifested quiet, rhythmic, effortless respirations. There were no visible pulsations of the aortic, pulmonary, tricuspid, Erb's point, and mitral heart sounds. The spine was vertically aligned. The abdomen of the client had unblemished skin. It was uniform in color. The abdomen had a symmetric contour. There were symmetric movements caused associated with the client's respirations. The bowel sounds were clear and equal in all 4 quadrants and were heard. There was no pain or tenderness noted during palpation of the abdomen. Range of motion was equal range of motion bilaterally. Patellar reflexes were present. They were 2 to 3. Able to balance Deer-Bromberg test. So scoliosis screening was negative with no deviation of the spinal cord. The cranial nerve 7 facial, cranial nerve 5 trigeminal, the cranial nerve 1 accessory, the cranial nerve 3, 4, and 6, which is the oculomotor, trochlear and the abducens were present. The cranial nerve 8, acoustic, was present. The cranial nerve 1, which is the olfactory, it was present. Cranial nerve 9, the glossopharyngeal, was present. Cranial nerve 10, the vagus nerve, was present. Cranial nerve hypoglossal, cranial nerve 12 was present in the assessment. And this concludes my physical assessment for today.